This is the monster-sized baby that somehow fit in there.
Oh my God! And it had to be assisted.
Had to be assisted. Okay. Yeah, he was quite stuck.
Okay.
Yeah.
Presentation was normal.
Presentation was normal. He just had ginormous knees and shoulders that were not coming through Holly's very narrow pelvis.
And how was she right after foaling?
She was a little sore the day after and was kind of like laying down a lot, but she seems to be good now. And she's bright, alert, running and bucking and playing around in the paddock.
Okay.
Eating great, drinking great. And that's the giant. Yeah, he will probably eat you.
Massive. He is huge. All right, so we'll see what she's got for general spinal positioning. Hey, baby girl, come hang out here. There we go. Alrighty. So obviously we're going to expect that the pelvis is going to have problems after passing a gigantic baby.
Yeah.
And she's got a little bit of a rotation heading into the pelvis, so everything is kind of drifting off to that into that right hind. So because she's sensitive, we're not going to get hands onto that area right away.
What do you find are the most common issues after foaling?
After foaling, well, obviously soft tissue and drainage are the big things because we're passing a bowling ball through a very small space. And so we're going to have swelling in the tissues. We're going to have fluid accumulation. And we need to actually get that fluid moving so we can have better blood flow and better neural signaling. Pressure of large foals, we start to worry about neural impact. So if you think about where the obturator nerve passes through the pelvis, we see this in cattle, we see this in horses with big babies. We start to get pressure onto the obturator nerve, which can affect the ability of the horse to bring the leg inwards towards its midline. So that leads to instability and horses having slip fall events because they can't engage those muscles very appropriately. So once we get past the soft tissue concepts, we start to think about how relaxin has affected the pelvis, and it's basically allowing the pelvis to pop apart so that we can have this foal pass through. And that creates inherent instability in the SI joints, into the lumbosacral joints, and even into the pelvic bowl. So we need that instability to have a baby pass through. Yeah. But it's not great when you're trying to walk.
Right.
So
a little uncomfortable.
Yeah. If there's any history of any type of joint disease, these guys actually feel a little bit better initially because everything is so loose, but they run the risk of hurting themselves and having problems. So we have to rely on muscular integrity to kind of hold the pelvis together. So our goal is to get everything, kind of centered up underneath so everything's in alignment as much as possible so that the muscles can act in the proper direction and pull everything together rather than pulling on odd angles and perpetuating poor bony alignments. I'm actually applying a tensional strain through the lumbosacral region to help her neurologically understand where her SI joints are and start to take some of that rotation out. And we're basically looking at different tissues perpetuating that rotation. So we're going to have opposites. We'll have tight on one side, loose on the other. And so we want to balance that left to right. Things that are on tension, we want them to match up. Things that are off tension, we want them to match. It's okay to have tenseness, but it needs to have some symmetry to it, and it needs to have motion. So she's starting to actually put up with me. She's had a few releases. Some of them are because of baby, thank you very much. And some of them are because she's actually buying into this process, so we can change up what we're doing. And so we start to think about how the semimembranosus and semitendinosus come up into the back side of the body, so that hamstring line, and attaching into the coccygeals, which basically have been distorted and moved because of birthing. And I'm looking at relieving tensional strain on both sides. So again, trying to create symmetry in both tension and laxity so that she has good proprioception or understanding of where her body is in space in the hind end, and so that she can move effectively and start to heal effectively as well. So it creates a more cohesive response in the mare. And this is really, when I think of mares, post foaling, the goal of treatment is restorative. So we want to restore anatomy back to its best possible alignment. And it's also physiologic in that we want to help heal all the tissues, and we want blood flow to start. And there's another great side effect, and that is we hopefully will turn on the baby makers a little sooner as well. Right. Because some of these mares, as we knew last year, reproduction was a bit of an issue. Mm-hmm. And if we can get things moving and grooving a little earlier in their postnatal phase or postparturient phase, hopefully we can see a return to capable reproduction a little faster. Yep. So that we're not having foals at really peculiar times of the year. Yeah. Here we go. So you can see with her that we have a much better line going through. She's still fidgety on her hind end, but I would be too after having a baby. But we've got a much better alignment through the lumbars. Yeah, she says, I want to scratch my butt. We've got some softness in through here, and she's starting to actually use her abdominals to lift her back a little bit. So again, cohesion of motion. This is going to make for a stronger mare. Yep. It's going to make her better able to go out and actually feed herself and feed the baby. Right? And they're going to have a much nicer time moving around. The other aspect from an osteopathic perspective, improved blood flow doesn't just affect what's inside, but we want her to have maximum lactation. Right. So this can actually have a nutritive benefit for the baby, because mom's going to have perhaps less risk of mastitis, less risk of not providing enough for our gargantuan baby, right? The beast. Her milk production may stay higher, and we may see a little bit better constitution of vitality, which means she's not going to use up her body stores so much to actually generate milk for this guy. Nice. She'll be a little more efficient.
Efficiency is good.
Efficiency is good. Yeah. Health is good. You're having a good time with that, aren't you? Yeah. But it doesn't take a lot of intervention to actually make a change, because these guys are so loose. So it's pretty nice way to get them started on the right hoof. Your mother's going to push you over. Yeah, they're all having a good time. Are you having fun with that? Yeah. Excellent. Yeah. Everybody's good. Perfect. When we're looking at a little guy like this who's just been popped out, birth is a traumatic event, and you don't get true bony lesions being formed during the birthing process. Usually that's a congenital thing because you can fold it up too tight inside the oven. So what we're looking at with him is really trying to create laxity in tissues that might restrict his growth. And in his case, because he's so long, we're really looking at the fascial lines on the legs and going up into the body. So these things were folded up inside mom, and they're bound to have some fascial restriction. And because he's grown about 87 inches since he was born, he's going to feel the equivalent feeling of having a pair of pantyhose put onto a wet leg. They're going to stick and twist, and they're going to feel restrictive in a weird way. Not such a way that you're like, oh my God, I can't move. It's just like, oh, everything just feels tight. Yeah. So, and he does definitely have some tensional strain, particularly through the back legs. Yeah. I'm getting some tightness up the medial aspect. Hi.
He had stretch marks at 3 days old, and most of our foals don't get them until they're 2 weeks.
Yeah. So he's got that tissue tension, and it's almost a weird feeling from an osteopathic perspective, because what you feel is the bones. Hi. You can feel the bones, and then you get this sensation. It's like, why are you on that side? I'm going to switch sides for I think I'm freaking about. You get this sensation of the muscles being too short for the bones. So the bones elongate, but the muscles haven't figured out how to. Yeah. And yet still hold them up. And then, of course, the fascial planes become really, really tight as well. So it doesn't take long. We're doing everything on palpation. And then when you feel a change, the change is there, and you move on. Hi, baby. Don't beat up.
Yeah, I just had my treatment done this
Yeah, don't just
Put out of whack.
don't destroy the human. Hi, baby. Good boy.
Yes, I feel weird.
Good boy. Yeah. So he's got a little sensitivity on this side. No, it's okay. Let me come up to it. Okay. Okay. So the blanket is hiding what I'm feeling, but he has an asymmetry in the musculature of his lumbars going over his sacrum and hips. So we're talking the gluteal masses as well as the axial muscles. And he's got some asymmetry and tension and tone. And even one side feels bulkier just because it's shortened up, right? So that's the side he's actually bugging me on, like those hind left. He thinks I'm stupid.
Right.
So he's definitely got some discomfort in there. And we've got a little bit of pelvic torsion. Babies get so excited.
What's happening?
He's like, oh, I have no idea. I have no idea. I'm going to yeet the auntie in a minute. Here we go. What a good little one.
He says that feels good. Whatever you're doing feels great.
Yeah, he started, well, once he bought into it and realized it wasn't actually as painful as he thought it was, then he was cool. It was a little startling for him, so he was not sure whether I was predator or not, but now it's fine. Okay, big guy, once we get. So this is the other half of the equation, is having your foals checked, because especially when they're overcooked,
Yeah.
you want to make sure everything is balanced out and moving, and that we have appropriate set everywhere. Oh, I know. One more leg, little man.
Swap sides.
You're perfect. I'm just going to sneak in here. Hi, baby boy. Hi. Oh, you're so good. You can numb my hair if you need to. Just don't eat my head.
Just don't worry, I don't have tubers yet.
No, he said, but I'll gum you to death.
Yeah.
You're going to gum me to death? Oh, yeah. Oh, you're going to explode? Explosive, baby. Explosive.
I think it's just weird.
He was probably side bent to this side, I would guess, because of the shortened lumbar muscles on the left.
Right.
I would guess in utero he had a preference to kind of be bent a little to the left.
Yep.
Oh, almost done. Almost done.
Okay. I would have had been packed in there real tight because Molly wasn't very big.
No.
Her belly really wasn't that distended.
So he was like one of those mattresses you bought,
Yeah, for like
where you
all
just,
up.
they blow up. Yeah. So I'm working into the shoulder muscles that pull into the mid back. So we're looking at the latissimus dorsi. And that is a good connection point to the spine when he's starting to let go. Hi, baby. He's pretty symmetrical with his head, which is great. He's like, oh my Ellen. I understand what's going on a little bit underneath the jaw. So oral diaphragm, nursing is hard work. Hey, good boy. There you go. We're going to let him go. All right, so getting that neck set up will help with his TFA, which will make it easier for him to nurse and eat. And also, he was quite folded, so it was nice to see that let go, and now he can start to get some growth and movement on the legs.
Yeah.
When the fascia is tight, he's not going to have his joints work properly, so everything becomes very posty and very straight. So if we can keep that moving.
Oh, I feel weird.
He said, I'm a stallion.
So that had to do with, because like he's got the bigger stretch mark on the left side than the right side. That would explain that.
That would
Imbalance.
That would, yeah. That makes a lot of sense based on what I was feeling from the top line coming down.
Yeah.
So that is very cool to see. Excellent. So both mom and baby are set up.
Awesome.
Yeah.